My name is Frank Liporace. I'm the chairman of orthopedics and chief of adult reconstruction and trauma at Saint Barnabas Medical Center. So I am a orthopedic trauma and adult reconstruction surgeon. And what that means is I deal with the gamut of extremity issues that can affect the patient, whether it's due to having an accident or an injury, a complication of having been treated for one, and then finally the ultimate in terms of taking care of patients for chronic conditions like arthritis, offering them joint replacements of the upper and lower extremity, and returning them to their daily activities of living. My philosophy of care is really to follow evidence-based medicine and tailor that medicine per patient, meaning that we all are different. There are many treatment options for many diseases. Everything is not a hammer and a nail, so to speak. We have non-operative options that many people should be offered prior to receiving surgical options. We're treating X-ray treatment is the wrong treatment. We're treating people. So it's a combination of what their complaints are, what their history is, what their expectations are, and what we need to do to really bring them back to where they want to be. So a question always asked is, why do you do what your profession is? And the answer for me is simple. I receive enjoyment out of it. And the bottom line is interacting with people, taking them from one point in time where things may not be as good to another point in time where they're back with their friends and family, activities, playing sports. Watching that progression and getting to know them over months, years, and even decades really is fulfilling.